On behalf of Family for Every Child and ECPAT International, I welcome you all and thank you for joining us today for this important and crucial topic. My name is Rajiv Roy, and I am a senior program advisor at Family for Every Child. In the last few years, our interaction and our members' work with the boys, along with the recent Blue Umbrella Day campaign, brought a focus upon how boys are affected by sexual violence and how they need protection from such kind of violence. In this webinar, we will build on that conversation to explore through a panel discussion involving local CSOs working on the ground in India, Morocco, Colombia, and Guyana. Through a collaboration with ICPAT International, our friend Francisco Chicon is here. We will create a space for exchanging good practices around healthy masculinity and harmful social norms. Many organizations around the world are working on these issues with the aim of improving the response to sexual violence. I would like to draw your attention to today's agenda. And this webinar will run for around 90 minutes. To begin this, Francisco and I will share briefly about our initiatives on sexual violence and exploitation of boys. Then our panelists will answer some key questions based on their experiences on this issue. Our moderator, Dihema and Liu, will make a proper introductions of our panelists later. Thereafter, the panelists will answer your questions. So there will be an open question and answer session. Please write your questions in the chat box with indication of the panelist you want answer from. We will take as many questions as possible. To let you know about the organization that I work with, it's Family for Every Child, which is an alliance of currently 46 civil society organizations in 38 countries. We have goals around preventing family separation, strengthening families, and protecting children outside any care. We have a strong membership base with rich and unique understanding of situation of children and families in local contexts, as well as potential solutions and effective interventions for improving the situation. As a global alliance, we work to ensure that more children can grow up safe and protected in families and be provided with quality alternative care whenever needed. Let me talk about our one program, which is specifically on sexual violence against boys, and that is called Blue Umbrella Day campaign, which is an annual day that we celebrate on April 16th. And the key messages around this campaign are that boys also need adult care and protection. They can be victims of sexual violence, even online. Being a real man means being kind to yourself and others, okay, which talks about, again, healthy masculinity, and also advocating for support services that are inclusive for boys too. This year we have 22 members from 20 countries participating in this campaign, aiming to reach about 300,000 people. Apart from awareness, this year our focus is on advocacy too. Blue Umbrella Day campaign basically is a result of evidences gathered through Caring for Boys research, carried out in 7 countries since 2018. We also have a program around supporting children affected by problematic and harmful sexual behaviors, where research shows that more than 90% of such affected children are boys. Now I request Francisco to share a little about ICPAT International and their program on Global Boys Initiative. Over to you, Francisco.
Thank you, Rajiv, and hope you hear me correctly. And hi, everyone, and welcome, and really appreciate you being here today with us. I'll try to be very short and leave time to our panelists. If we can just move forward with the slides, please. Yeah, perfect. Thank you. Just a very quick introduction to what ECPAT International is. We're a network organization, meaning we have members in different countries. You'll hear from two of our members today, focusing specifically on ending all forms and manifestations of sexual exploitation of children. And we've been doing that for over 30 years now, really mobilizing our networks and partnering, making sure that we have evidence, data, research, but also action on how to prevent and respond to cases of sexual exploitation of children. Our main office is in Bangkok, but we're spread all over the world as well. And for our Global Boys Initiative, here you can see our presence, but for our Global Boys Initiative, again, very quickly, it's an initiative we started a couple of years ago, specifically looking at the question of the sexual exploitation and abuse of boys in all of their forms. And one thing to make clear is that the reason behind the Global Boys Initiative is really to make sure that we address this issue that it's oftentimes untackled, unexplored, undiscussed. And we really appreciate also the collaboration with Family for Every Child in shedding light about this and starting the conversation on the issue and different solutions that we can bring about. To base our Global Boys Initiative, we conducted research in 10 different countries across Latin America, Europe, Africa, the MENA region, and Asia, but also a series of case studies, including with our colleagues here from Colombia and Morocco, to really identify what practices seem to work in working with boys who are at risk and boy survivors of sexual abuse and exploitation. And all our case studies have been published on our website, and I'll be happy to share them as well with any of you that are interested. And the idea of that is really to shift in the conversation away just from research and evidence, but also to start taking action and looking for solution and provide practitioners with concrete ideas and practices and approaches on how to manage cases of boys who have been subjected to sexual abuse and exploitation. In 2 weeks' time, we will organize the first Global Boys Summit with practitioners from more than 30 countries to come together and reflect upon solutions and action points to actually bring the conversation even more further. And after that, we will do some campaigning around it. We will share the action points that come out of the Global Boys Summit, from bringing together the practitioners and communicate around that. So please keep that in your radar. And I'm looking forward to today's discussion, and thank you very much.
Thank you, Francisco. Now let me introduce Diohema Anelu, who will be moderating the panel discussion. Diohema Anelu is advocacy director for Hukhoni Foundation, a member of Family for Every Child based in Mexico. Their work is focusing on developing, applying, and sharing solutions for children, adolescents in extreme poverty, excluded, marginalized, and their families affected by violence. Diohema, over to you.
Muchas gracias por la presentación, Rajiv.
Thank you very much for a great introduction, Rajiv. It is a pleasure to be here. Thank you very much for joining us. We have a great panel today for this great conversation. So we have great panelists coming from different organizations, countries, and regions in the world, and they're going to talk about their experiences, and then I'd like to introduce them to you. First of all, we have Aude Sever from the Morocco, Amman Morocco Association. This is an association that was created in 2009. They've been working for more than 10 years with the main actors related to childhood and teenagers and youth, different associations, schools, community centers, etc. They work with different representatives of the young sports and education ministries, and also the family ministries. And their aim is to get to the main actors related to childhood, and this is a great pleasure to have them with us. Now I'd like to introduce you to Nelson Rivera from Fundación Renacer Colombia. They've been working since 1988 against sexual violence against women, children, and girls. This foundation in Colombia has done or has carried out or has contributed in many laws for public policies against trafficking, and also they've been contributing in special plans in different cities, and they work as well with different cooperation agencies that are bilateral bodies as well. Professionally, Nelson is an educator and therapist of children and young people that are vulnerable, that consume or take drug substances since 1988. It is a great pleasure as well to introduce you to Omati Madre from Childlink Guyana. She is the director of this organization based in Guyana. They are members of Family for Every Child. They've been working for more than 2 decades in this field, and they are focused on the collaboration of the different stakeholders in order to strengthen different systems, policies, and practices to protect children and against abuses, also including sexual violence.
It's also a pleasure to present Mr. Hassanitini, who is part of the Tini Guyana. He is the Monitoring and Evaluation Manager of Childlink, and supports program management, strategic planning, monitoring, evaluation, public education, research, and resource management at Childlink. Also want to introduce from India, which is part of Family for Our Child. She's the founder, as I was saying, and director of Us Life in India, known by their value in the participation with children, always promoting innovative approaches to change the lives of children. She started in the environment of community health and the capacity building of women, which is a pleasure for me, because if you see here, we have a great list of panelists, and we are ready to start this conversation. And also like to explain a little bit the dynamics. We're going to have 3 questions that are questions that want to create a discussion, to trigger a discussion, a great discussion, a conversation. And they're going to tell us from their experience what would be the best recommendation for us to bring valuable information home. I want to start with the first question. Then it's a question I'm gonna present the question in a general way, and then I'll say who's going to start. So the first question is, if you please go ahead and change the slide. What are the behaviors, the male behaviors in your context, and how would you define healthy behaviors in terms of masculinity? So I'm going to ask Odd to please share. Odd, are you there? Can you share your experience in terms of this first question, please? Thank you.
Yes, hello to everyone. My name is Aude Edanger Sede from Morocco, from the ONG Amman. So I've only got 3 minutes, so I'll try to be laconic. In Morocco, we have had several progresses, legally speaking. There has been programs that were put in place in order to promote the gender equality. And despite that, there are still behaviors that stay accepted, that are still accepted by the society and are seen as the dominant masculinity. Those masculine behavior come from a social construction that reflect an acceptation and practices of and dominance of men over women, and as if women were inferior because of some vulnerabilities that they have. Some behaviors are reflected in forms of violence, and that encourages boys from the very young age to practice violence, and that encourages them to hide any violence that they suffer from themselves. A real man in this society is seen as someone who is strong, who doesn't cry, who is proud, and that leads boys to conceal and to hide any violence that they suffer because they are ashamed of that and because they think that that would make them come across as feeble. These behaviors obviously conduct to gender stereotypes, and that lead boys to try to be masculine, machist, and they have violent behavior, and they want to convey an image of them as being a strong and competitive man. So this masculinity is associated to physical violence that is reflected in the relations between men and boys and women and men that are quite violent. And as opposed to that, what we expect in terms of healthy masculinity, and that's the second part of the question, we are expecting a less toxic masculinity. By less toxic masculinity, I mean that that is a masculinity that has less bad effects on the society. Healthy masculinity behaviors would be behaviors that would allow boys to express their emotions, to feel less obliged to do what they think the society expects them to do. They would be more inclined to express their emotions, not to conceal them, not to be violent, which will in turn lead to a decrease in violence as a whole. Being more empathetic, and having more open relations with the society, with other members of the society, more open relations based on communication. That signifies that boys should not perceive expressing their emotions and weaknesses as being weak or feeble. We conducted research in our association, and we realized that having that approach would lead to freeing communication and will probably allow boys to speak more about any kind of forms of violence that they may have had and suffered from in the past.
Thank you very much, Odd. I think these initial words and the experience that you have with your research and how the expression of feelings can help towards a more freedom and maybe the impact that it may have in the community could be it's a good thing to have these first ideas. And now I'm gonna invite Rita from Butterflies to continue with this conversation and to reply to the first question. Go ahead, Rita, please.
Thank you. I resonate what Odd has said. It's the same.
J'entends bien ce que vous dites.
It is the same as in India. The dominant notion of masculinity in our context is based on patriarchal values and social norms. It revolves around strength, that is physically to be a strong man, courageous, brave, independent, emotionally repress one's feelings, not to cry or show pain, and with some entitlements to use violence when perceived to be necessary. So violence can be used, it's an accepted norm. There is considerable pressure from family and society to fit into this image. And I must say that this notion of masculinity is reinforced in India by the entertainment industry, our Bollywood movies. The men are shown as very strong and brave and sometimes toxic masculinity. Whereas for us, to be masculine doesn't mean any of the above. A healthy masculine behavior would express feelings of kindness, gentleness, of hurt, sadness, and pain without emotionally suppressing it and being ashamed of it. To realize both boys and girls can experience similar emotions. To seek support when hurt and not view it as a lack of courage. Respect gender, equality, believe in democratic values, and to recognize strength and courage lies in accepting who you are and resolving conflicts through dialogue and not use of violence. That's what we would say is the behavior that we would want in what we say is masculine. Thank you. In a nutshell.
Thank you. Thank you very much, Rita. I
Thank
think
you very
you have
much.
just
I
shared
think you
some
said-
characteristics very important that we see in boys and how the entertainment industry generates this toxic masculinity. And to go on with the conversation, I'm going to ask Nelson to please share his experience from Colombia. Go ahead.
Entertainment industry.
Hi, good morning. I want to say hi to all the panelists and all of you that are here with us. First of all, I would like to say that I completely agree with what has been said. I think the situation is quite similar in many different parts of the world, and in countries like Latin America. I would like to introduce right now just a little thought, and that masculinity is rooted in the history. We have over 500 years of colonization
in our countries.
We are
and
a
our
country
has
that
gone
has
through the wars
the colonization
of
wars, and then the independence wars, and then
and
a whole series of different social conflicts,
series of
social narco trafficking.
Hello.
So we have two interpreters speaking English.
Oh,
so
sorry.
we should only be hearing Diego, I believe, coming into English from Spanish. Tim, then I believe it should be you going from the English channel into French. Did we have a bit of a confusion there?
Thank you for that.
Let's
so
start again. Yes,
can I go ahead? Yes, go ahead. Okay, so as I was saying, in a country like Colombia, violence has marked our history for 500 years, and that has to do with the way we have learned and we have assimilated the concept of masculinity. Today, we have a generation that's a bit different. It's a more globalized generation. It's a generation that is more technological, is less rooted, that has a more universal vision, and that is a hope towards change in terms of these gender stereotypes that the speakers before me have just mentioned. I wanted to add that masculinity, we understand it as a continuum in where there are two extremes. In one extreme is those qualities that could be positive, but that could also be exacerbated. That is, masculinity is associated with being a conqueror. Man is a conqueror. He takes risks. He is strong. He's adventurous. He's expected to also be romantic. That he falls in love. That he has that capacity to fall in love and to conquer. To be able, business-wise, to be smart, business-wise, and that has a visionary, that he's visionary as well, and obviously in some cases as well to be heterophilic, that is, that accepts heterosexuality as the behavior pattern. And then on the other extreme, we have at the same time other qualities that could be this toxic masculinity that we're talking about, this unhealthy masculinity. So men could be self-sufficient, egotistical, without limits. He could go against the law, or he can, we've seen it with narco-traffic phenomena. There's the whole masculinity model that is associated with narco-traffic and also associated with armed conflict. Men can be impulsive, aggressive, dominant, whereas he can be an adventurous, but he's also irresponsible, and he's romantic, and but also be a womanizer. So, and if he's also a smart businessman, he can also be without scruples. So in that type of continuum, we can find that healthy masculinity, the one that we call healthy masculinity. I'm not really, it's not one extreme and it's not the other one. We have to avoid one, the most negative extreme, but we also have to recognize the value in this other extreme, in this other side of this continuum.
Thank you very much, Nelson. So you insist on this historical side of these masculinities and this example about the different extremes, how you can find these differences. I think this is something very clear, where toxic masculinities and healthy masculinities. Now I'd like to take the opportunity to invite Hassani in order to talk about this and give a response to this question, and also talk about the child link experience. Thank you.
Thank you, Dioma. Rajiv, if you can share the screen for me, please. Okay, so from ChildLink's experience, our experience is similar to those of my colleagues that went before me. And I'll be drawing from the Caring for Boys research that ChildLink completed in 2021, as well as our experience engaging children in secondary schools in sensitization sessions. So some of the male accepted behaviors that are not exactly positive behaviors that we have observed in our engagement with children, we found that masculinity is tied to aggression in relations to our communications and behavior. So your tone of voice and your choice of words, your mannerisms are expected to inspire fear or respect. Anger and rage are viewed as masculine traits. Toughness and physical prowess. Toughness refers to one's physical strength, stamina, and ability to endure pain. So boys especially are expected to be strong. They're expected to be able to endure a lot of physical pain. In terms of physical prowess, this relates to your physical abilities. For instance, boys are expected to be athletic. They're expected to be proficient in manual labor, and they're expected to have sexual prowess. So consequently, emotional intelligence is not viewed as masculine. Men and boys are determined to be masculine based on their physical prowess and their toughness. Another behavior that is common in Guyana with respect to boys and men, it's dominance over females. So this is self-explanatory, but your level of masculinity in Guyana is correlated to the number of sexual encounters you've had. Males are expected to dominate and not to be dominated. And this makes it challenging for males to report sexual abuse. Communicate swag and not feelings. So swag is a colloquial term that means confidence, bordering on arrogance. So it is essentially machismo. You're not expected to communicate emotions that highlight vulnerability. This is a hindrance to your masculinity. In Guyana, confidence is expected to be communicated. You're expected as a male to be invincible. Homophobia. Guyanese males are heavily influenced by hip hop and Jamaican dancehall music. And these musical genres, particularly Jamaican dancehall, have strong homophobic content. And this again makes it challenging for boys to report cases of sexual abuse. Wealth accumulation, their male worth is determined by what you own. So for teens, masculinity is equated with the ownership of brand name clothing or cell phones and other material things. And this places boys at risk of child sexual abuse since they are groomed by perpetrators with promises of material gifts. And lastly, disdain for authority. Males are expected to show no fear of authority figures such as police or teachers. In Guyana, there's a lot of violence in schools and violence in the society as a whole because of this disdain for authority that men and boys are expected to portray. Now, in terms of the healthy behaviors that we would like men and boys to portray, we would like to see healthy communication, because in our Caring for Boys research, we saw that boys struggle to communicate and express their vulnerability. So for males to exhibit positive behaviors, we expect healthy communication, especially between fathers and sons. Emotional intelligence. So boys, we believe, will benefit from recognizing and understanding their emotions as well as the emotions of others around them. So with respect to emotional intelligence, we'd like to place emphasis on empathy and emotional regulation. Because as I mentioned earlier, unfortunately, anger and rage are seen as emotions that boys are expected to portray. Finally, on the positive side, we expect boys to show respect. We expect boys to have an understanding and a commitment to respecting the rights and bodily autonomy of females. And based on our experience engaging children in schools, the issue of consent seems to be one that is of importance. So it is important that boys understand that they must respect the bodily autonomy of female, show that respect for them. So I think I will wrap it up here. Thank you so much.
Thank you very much, Hassani. I see, well, this piece of research that you shared with us, the different topics that you talked about these toxic masculinities, how this kind of masculinity is impeding these young boys and males to be able to talk about sexual abuse and how they can feel vulnerable in their relationship between parents and fathers and sons, and this emotional intelligence that is related to the ability to communicate, to have a good emotional intelligence, to show respect. So with this participation of all of you, we are starting to have a big first idea about this topic. And this leads me to the second question, which is the following. We want you to share some good practices program, project, intervention that you have carried out in your own organization in order to prevent sexual violence against children and male teenagers. What worked in this strategy and what was the impact that it had? So please, I'd like to have Omati to start answering this second question. Thank you very much, Omati.
Thank you very much, Dioma. It's a real pleasure to be here with everyone and to share a little bit on what we have done in ChildLink. I will share my slide. I hope everybody could see my slide. Can you see my slide now? Can you see my screen?
Yes, we can see your screen, Omari. Thank you.
Great. Okay. Thank you, everyone. So there are many programs, across the globe in the Caribbean that outline good practices and focuses on how we support boys to develop and embrace healthy masculinity. For us in ChildLink, good practices for preventing sexual abuse of boys and embracing a healthy masculinity are built on broader collaboration with both government and civil society agencies, engaging with the grassroots and working directly with children and their families. We collaborated with the National Child Protection System, developed the Child Advocacy Center services in around 2014 to specifically provide services to children who report sexual abuse and to conduct national public awareness campaigns to improve reporting. By 2018, there was a 300% increase in reports from boys who have been sexually abused. The awareness campaigns were done by ChildLink and the Child Protection Agency. That collaboration allowed for the campaign to be run nationally. The Child Advocacy Center services increase the confidence of boys and their families to report. However, boys and their families still do not follow through with the support services compared to girls. We have expanded the services, and we have looked at how what we are learning becomes sort of a guide on how we expand the service. So expanding with several partners, including local authorities, government agencies. We call that expanded aspect of it 1,000 boys. It brought together government, civil society, and development partners. In this slide, you'll see our Minister of Human Services opening one of the CSCs along with EU and UN representative and of course ChildLink. The idea was to ensure that government as well as development partners are working very closely with civil society on the issues that are raised by children and their families, but more so for government agencies to work more closely with civil society to sustain these initiatives. The 1,000 Boys Initiative worked across several regions to improve regional and national systems and services for reporting and responding to child sexual abuse. The initiative worked with grassroots partners, the National Child Protection System, the judiciary, the police department, local authority, and schools in all the community where the project is being implemented. The project established services for reporting child sexual abuse in rural indigenous communities where no services existed before, as well as Georgetown and our main coastal areas. The centers provide emotional care for children who reported and supporting prosecution of sex offenders. Child advocacy centers were set up in semi-rural communities with forensic interviewers and counselors and operated within a multidisciplinary team, which include police, child protection, and the judiciary. The 1,000 Boys Initiative specifically aims to increase the level of awareness of boys who are being sexually abused and in need of care and protection, and to encourage both men and boys to have an active role as advocates for the prevention of sexual abuse. I have a video that I want to show, but I'll get to that shortly. Ideally, we aimed overall to reach 1,000 boys to become advocates. We wanted to create a forum, create platforms for boys who have an interest and would like to become advocates and to speak out about child sexual abuse, to be able to have easy access to those forums, but also to utilize what opportunities existed in their own schools and community. To date, over 5,000 children in schools have been sensitized, and just over 1,000 boys have indicated their interest in becoming advocates. And they have been speaking out against sexual violence in their schools, in their community, in sports forum, on the radio, on television, and on our social media platforms. I will try to open this video quickly so that we could see some of the boys in one of our online programs.
Yeah. The sexual grooming. So can you guys give me your thoughts about sexual grooming? How would you describe the term sexual grooming?
I would describe sexual grooming as the process by which an adult will gift or reward a child with items with the intention of having it returned with a sexual favor or action?
Well, from my point of view, sexual grooming is whereby an adult is preparing a teen or a young teenager, say, or a young person, to have sexual intercourse with them later on in a point of life. So they are making
Omati, you
when
need
is
to
the time?
share the video because we are only listening the audio. Can you help with that? You need to put in the screen because we don't see the video. We only see hear the audio.
Okay. I'm not quite sure I know how to do that, so I think I'm gonna share the slides with the link, and I'll ask persons to look at it. It's quite a well, it's a 30 minutes video, so I think I can wrap up here by saying that one of the good things about this particular initiative, or some of the good practices, is that it worked at the level of the child protection system, but also bringing on board all the key stakeholders that are necessary for, their engagement is necessary for the level of change that we are looking for at the level of policy, but also at the level of the community and within the family, so that parents and children have this information, and boys are having an active role in speaking out against sexual abuse against boys, as well as sexual abuse against girls. So I'll wrap up here and share this so that everybody can have a look at the video in their own time.
Thank you very much, Amati. I think this experience that you talk about creating advocates and these children, and how you created a strategy to be something that was built from the community, and have these children being their activists and defenders, and the experience that you had defending, and the incidents you had with the different governmental agencies. Very interesting. And now I'd like to invite Nelson to see if he could share and reply that second question about a good practice or program that's being carried out in Colombia. Go ahead, Nelson. Yes, okay, thank you. Well, I would like to talk about two things. The Renacer Foundation works in the research of the problems of sexual exploitation and violence, sexual violence against women and children in prevention and specialized attention programs. Now I'd like to talk about prevention. Our focus, or our strategy is protecting environment, is what we call them. And they have different contexts, particularly when there are a big tourist activity, and this protective environment wants to encompass a whole community or a whole city. And we started it in 2008 in Cartagena here in Colombia, which is a very world-renowned place for tourism. And what's the essence of this protective environment? First is to create jointly with communities and the groups, self-reflections around behavior and practices that foster sexual violence, or that facilitate sexual violence. So therefore, these are fora, processes, and different activities and meeting spaces with different actors from the community, businesses, with the communities, with state entities, to talk, to have a conversation about what goes on in the communities in terms of violence. We think that if we work in that transformation of the imaginary as a collective process, we could create or generate jointly work and have the same objectives and have a protection vision around boys and girls. That is the essence of this protective environment, which, as my colleague was saying, is to bring all the parties together in a way that they feel co-responsibility, and also from the perspective of human rights and children's rights. So it's been a very good experience, a big experience. And one of the most significant impacts of this experience is that in several communities, not only in Cartagena, also in other cities, networks have been created, community networks and children and teenagers networks that carry out a work of advocacy and sustainability of this strategy of self-reflection. Now, in the part of attention, we start off with the concept, with the understanding that victims go through traumatic experiences and they need a specialized therapeutic care. So in Colombia, we have certain homes, therapeutic homes, where boys and girls, they share their experiences and they work together to have their emotional recovery, of course, led by adults specialized and professionals that are specialized in the managing trauma and violence. Now, what is this then? What this mixed strategy defies the gender stereotypes because boys and girls learn to live with the same equal conditions. The day-to-day work, the daily work, the governing of the home is shared by boys and girls. And that from the start, as Francesco said in the report, challenges that notion of differences and inequity in the gender, from the gender perspective. Also, we have a empowering of rights. And when we're talking about this, we're saying that boys and girls, they are able to recognize the other as a person that has the rights the same as themselves, right? So an equity perspective. And with that, I believe that we are contributing, and we actually have seen it, how the boys and girls that become adults or young people, they create, they generate their own families, and they have a very clear vision in their personal lives and in their families, and they become citizens in a bigger sense, that have a transformative vision, a vision that goes beyond the gender violence and gender inequity. And we believe that we are adding to create a generation of new generation with citizens that have a different vision in terms of gender and masculinity. Thank you. No, thank you, because this practice that you are sharing with us is very important, because you touch about two topics, protection and attention or care, and how we can build a citizenry from the base of rights. I think that's fundamental to create networks, to create co-responsibility between adults that go with children, but also how the children themselves have to be responsible. And very good that sense of the new generation that you're creating. And following with this conversation, I will ask Oti to share that experience in also trying to reply to that second question. Go ahead, please. Omati? Ode, I'm sorry.
It's a program that aims to provide a protective environment for children. Can you hear me well? It's a program, as I was saying, that we put in place with UNICEF, with the support of UNICEF and European Union, in collaboration with the Ministry of National Education and the Ministry of the Family. It's a program that aims to reinforce capacities and it was elaborated based on a communitary and participative approach that involved influences from the Moroccan society. The beneficiary of the program were social workers who work with children, the children themselves, their families, and all kinds of professionals that can be in contact with children, boys or girls. This program allowed to design and to test a scheme that aims to promote gender equality through a more positive and healthy masculinity and kind parenting approach. The goal of it is to reinforce capacities and to bring social workers, teachers, children and their family to think about the deep causes of violence and to show how some kinds of masculinity were more prone to lead to violence and some of them were more prone to lead to more respect towards children. This scheme was designed based on a cascade-based approach. Our association accompanies and supports professionals in order to ensure that then they are able to do this work with children and their family and to create a more balanced relation between children, between parents and children in the children education. The capacity strengthening is based on theoretical and practical knowledge that allow us to better know what are the children's rights, what are the commitments that were made in this field, and what is masculinity. And there are also different group exercises, storytelling exercises, different kinds of workshops that are there in order to allow to free expression and speech and communication for all the beneficiaries and participants in order for them to reflect on this topic and to think about different solutions. This scheme allows to acquire common knowledge, to change the mindsets, and that allows to understand that it is possible to change behaviors of boys. And if boys have violent behaviors, it's because they think that this is what's expected from them, from the society. Sometimes we have in front of us audiences that have very strong resistance to this. So our work is not to show them that we are right and they are wrong. It's rather giving them elements for discussion, having a debate with them, also accepting that some people probably are not ready to have this change in their mindsets towards the equality between men and women. But we are there in order to give them different elements, different clues, and show them that it is possible to break free from patriarchal schemes and that healthy masculinity exists, and those models can have can be very beneficial for the whole of the society and for boys in particular on the psychological and social, in psychological and social terms. So this program allows to have a better understanding that violence often comes from perceptions in the society, and it allows to have a reflection on what it means to be a man and a woman in the society. And we can do it through different ways. And I would like to add that in this program and through our different interventions, we tried not to bring any stigma on boys, keeping in mind that they are victims too of all these stereotypes in the society. But we also tried to still showed that they did have some responsibility in changing that. So we wanted to show that men in society, as for now, still stay the main audience who commit different ways of violence. And that violence was something that was suffered not only by girls, but also by boys. And we tried to make people understand that these ways of being are negative for boys from the psychological terms. And if they grow up to be a man in such ways, it can be bad for them as well. As for the impact of the program, it's a very delicate question, of course. We can always measure the effect of our interventions based on new knowledge that has been acquired or based on different kinds of debates that raised out of that. And we also realized that after we implement all this program, there probably will be new ways of thinking. And when you work on changing mentalities, it's always interesting to also measure the long-term impact of our interventions. And a colleague of ours was talking about the creation of a new generation in order to lead towards changes in the society. So are we there probably to plant seeds that will later on grow? And we'll probably be able to see how people change their behaviors in the future. So in the exercises that we make with our children, often we form groups of children that then become themselves ambassadors in their schools through messages that they can deliver. And through all of these projects, we think that these interventions will allow these children to later understand these key messages, to adhere to those messages, and to pass them on to their peers.
Thank you very much, Rod. I think you talked about many things that are related to this management, this kind of management that is required when working with multilateral bodies, and also how to generate conversations so that the kids, the children, can reflect about their masculinities and how they can be responsible of their change of behavior. Thank you very much. And I'd like to invite Rita Panica in order to share her experience. Thank you very much.
Work at 3 levels. We work with the boys directly, with the families and the schools, and the community is part of it too. So what do? After the study that we did in 2018, when we realized—
Rita, can you please bring your mic closer to—
Yeah, sorry. As we realized that after our 2018 study, that how important it was to focus on boys, especially when we speak about sexual violence, because the lens through which all of us globally have been looking at sexual violence has been girls. And the boys have always been seen as perpetrators of a crime, and that they would not be sexually abused. So I think the study really brought out a lot of insights into the lives of children. So what we do is that as part of our life skills education program, we have a focused intervention for boys, which is age-wise, 9 to 12, 13 to 15, 16 to 19. And it's called a dialogue discussion forum. It's a safe space for the boys. Their experiences within their family, they share their experiences within their family, their parents, especially their fathers and mothers. extended family, the peer, the community, and in the schools, what have been their negative experiences that they have faced, the pressures they go through to fulfill the role of a son. In India, the son, I sometimes really I feel very concerned for boys because the sons have so much on them that they have to be, you know, the perfect man who would be courageous, strong, a household provider. So it's a big toll, a big heavy weight on the sons, you know, to fulfill the role of a son, the brother, the lack of space to express themselves freely, to share their problems, fears, aspirations, burden of expectations of being a household provider. They may have aspirations, but the whole thrust is you need to be a household provider. The struggles with their notions of masculinity, to be a real man, the use of violence, which becomes a norm, you know, that's when you're a real man. This is a safe space with this dialogue and discussion forum for boys to share their perceptions and views on how they would like to change their narratives of what a boy should be and expected to be by parents. Let them do the beginning, let them change the narratives, you know, and we support them to change those narratives, both with the parents, the community, the teachers, and have I gone? Can you hear me? Yeah, and teachers, community, and peers to discuss the notions of masculinity and sexuality. And here, when I say sexuality, we also talk about harmful and problematic sexual behavior, acceptable and unacceptable behavior, and non-violent communications. Different methodologies are used in this forum: storytelling, artwork, writing narratives, focus group discussions, and these sessions are held regularly once a month. The forum also supports boys to articulate their concerns regarding sexual violence, how to prevent and safeguard themselves from being violated. That's a safe space for them to speak about it, to educate them about online sexual abuse. They share about the dark webs that they get into, the chat rooms that they have gone into and what was happening to them. And some of them from online becomes offline sexual abuse. So how do we safeguard? So these issues, these discussions are also had in this forum. We also have a whole group of buddies. These are children who are trained in communications and empathy. And the buddies are the first ones that the boys would reach out to and say that I have got this issue. But we also tell them that, see, it's important to seek support from our caseworkers, who are our counselors, for therapeutic and legal support. And we hold their hands right through the legal processes and later. And we also work with the families if it's a case of sexual violence, so that the families are also go through that therapeutic process so that they don't feel that my son was not courageous enough or bold enough, you know. So we work with the family too. The forum sessions are held regularly once a month. We also have workshops with parents on specific contents, such as socialization of boys and the importance to recognize boys need care and protection and can be sexually abused too. The whole patriarchal norm of socialization needs to be broken down, and that to see boys and girls as equals, and both of them need care and protection. To relook at some of the negative social norms that exist in the society. The notion of masculinity, of being brave and courageous, we need to question those norms. To also discuss and share with the parents about the adolescent phase, the importance of listening and believing the child. It is a phase when they can get into risk behavior, and therefore you need to be supportive. You need to be listening to them instead of dismissing them off, and to believe in what they are saying. We also organize regular sessions in government schools, because we found that that's one agency that somehow doesn't speak about sex or masculinity. In India, in our families, we don't speak about sex. That's a taboo. Who will talk about sex? You know, In schools, the textbooks, they don't. They skip all those chapters, you know, they don't talk about it. Biology is only talking about other things, but not about sex. So we have our sessions in the schools. And I must tell you, the teachers sit behind and they listen. And some of them have come up to us and said, thank you for taking these sessions. I now know how to speak to my son. You know, so these sessions in these schools we take on child safeguarding, but also safe and unsafe touch, sex, sexuality, masculinity, what it is to be a real man, you know, the laws that are there related to sexual violence, the agencies, the persons whom you can reach out to support. So now the schools have child safeguarding policies. They reach out to a group of counselors. They also reach out to us if they need support and help. So we have what we say, the 3 levels of an education, support system, and protection. That is the child himself, the boy, the family, the peer, and then the schools. So it's linked in that way in which, so if you ask me what the impact has been, the impact, you need to measure it. I can at least speak about the outcomes of this. The outcome would be that now more and more boys are willing to speak up. They're willing to say that I didn't like the way you spoke to me or you touched me. They are willing to speak about that this whole burden that they hold in them to be bold and brave and courageous is stifling them, and they would like to change those narratives. So there is the discussion taking place, and which I think is a beginning. In the schools, they're talking about it. The parents, well, that's another issue. The fathers would have a different way of looking at things. The mothers have different. So it's a long walk for us, but they are listening. The very fact that they come for the session, for me, that's positive. And they see a value in it. And in some cases, the parents have said, by having our informal conversations with our boys, with our sons, we are learning, we're getting to know them. They never knew their sons. We're getting to know their sons. And I think that's a beginning for us to bring in about this kind of changes in a highly patriarchal society where we live in, that is India. Thank you.
Thank you very much, Rita, for sharing these programs and creating these differences between the different levels of intervention and how they are impacting the schools, families, the peers. I think this is very important what you shared with us about the different strategies that you have implemented. And by closing this second question and answer turn, you have given us many information to all those who are listening to you about how we can work around this. We have very little time left and we have another question. So maybe in a couple of minutes, each of you can talk about or share with us a closing idea that is related to the experiences, and which are the recommendations that you would give us, maybe regarding the caregivers, the mothers, parents, the government as well, in order to avoid these sexist behaviors and in order to give some sort of response regarding what a healthy masculinity is. So please be brief because we don't have a lot of time. And there were a few questions as well that we received and we wanted to answer as well. So Nelson maybe can close his intervention with his last remark. Thank you very much. I would like to share 2 recommendations, general recommendations. The first one is that the people who are training, educating, we need support and we need to be accompanied and to have a permanent training, because we are a result of this society that we are trying to change as well. So it is necessary not only to have some sort of technical support or technical accompaniment, but also a personal accompaniment or training, because we need to undo so many prejudices and stereotypes that we have on our shoulders because of our own story. So I think this is something that is key, training the trainers and the support for them. And secondly, to insist on the need to have non-segregated programs. I think we need to put boys and girls closer, heterosexual boys, cisgender boys, with non-heterosexual boys and transgender boys, because that's a reality that is we have at the moment everywhere in the world. And I think it's important to increase the ability of those programs that we carry out to prevent sexual violence as well. I think this is an area that we can work on. And another very important experience would be to bring to the conversation adults that have lived transgender processes and have a dialogue with these children so that they can see these models. They are positive models, positive people that they can look at, and they can help them in order to have this kind of way and transition. Thank you very much, Nelson. I think it was very clear, and it is a great opportunity to reflect about after this. Now, please, Umati, if you can share your recommendations with us. Thank you.
Yes, thank you very much. I can share briefly 2 recommendations. So what we've learned is that many boys don't learn healthy masculinity simply because it's not the norm in many families to teach this behavior to their boys. So whilst it's not the situation in every family, most boys, perhaps more boys than not, are growing up within families and communities where parents and carers themselves need to understand the whole concept of masculinity and, of course, healthy masculinity. There are fewer role models in the public, and healthy masculinity is not what is taught in homes and schools and community. The parenting skills education is therefore critical for supporting children through this phase or the various phases of their lives. Most parents will parent the way they have been parented. However, there's a significant need for parenting or this aspect of supporting children to be given more attention, particularly by service providers, because where do parents get this information from? Perhaps it could come through the education sector, it could come through the health sector, it could come through maybe their faith-based agencies. So parenting skills education should be included, maybe in pre and postnatal care services, early education, and where it's possible, maybe parent teachers association to improve the overall care and support to children in their development stages. Practical support include providing information, include discussions. I know here in Ghana, when parents go to the postnatal clinic, they at least have to wait 15 to half an hour for them to see the nurse and the doctor with their babies. And so these are opportunities for providing them with discussions and information. So this is something that we can raise with our health sector. And maybe to look at how this could be included in the school's curriculum. Rita did talk about the fact that teachers find it difficult to communicate this information. And of course, the second one is placing more of an emphasis on caring for boys. In the research, we learned where boys are likely to be abused, and we learned where the gaps were in boys having this information. Boys are more exposed in sports, in their communities, and generally in activities outside their homes. We also learned that boys identified receiving gifts as a form of their parents showing affection. This association has placed them at greater risk of being groomed for sexual abuse. Some of the boys in the study indicated that their parents have never spoken to them about sexual abuse, and one of the FAD indicated that this is a mother's role. So there's a general sense that boys are growing up without adequate emotional care, spending quality time with male family members and learning from them, and having someone to share their everyday lives with or being understood and listened to has not been the norm for boys. And and therefore learning healthy masculine behavior. In these situations, boys don't have the tools, and it will be difficult for them to develop healthy masculine behavior. In the Caribbean, and this is becoming perhaps a global trend, more children are growing up with one parent who mostly don't and will not have enough time for emotional care. Mostly children are growing up with their mothers. In our society, we have a sort of a syndrome, we call it, but there's just not enough time with the fathers. So we've utilized various tools to help communicate this message publicly, and we've done some soca songs as well as engaging with the Men on Mission, and this is the Men on Mission is a new group that was established by our president, mainly to have a role in social issues, and us including them in these deeper, in the Bud campaign in particular, help them to connect a bit more with these deeper issues. So I want to try and share my screen for a minute and briefly to share a little bit on maybe one of our soca songs. Let's see if I can do it this time. Hopefully I can get it done this time.
Yes, we can see your screen, Omari.
Yes, let me tell you a story of a little boy, so innocent, then one day innocence destroyed. He put his trust in the adults around him to keep him safe. Just got broke.
So that's a brief on the let me stop sharing. Yeah, because I know we're running behind time, but that's briefly to give a bit of a recommendation of what's being utilized and have some bit of progress in our work. Thank you very much.
Thank you very much, Amati. I think those recommendations are very succinct and clear. And so we can start thinking about how we can put it into practice. I'm going to ask Aude, please, to give her final comments in terms of experiences or recommendations that she could give to us.
Okay, thank you. Well, there's a lot of recommendations that have already been given by other speakers. I'll probably just go back to the question of segregation in programs. There's a lot of programs that are destined against violence based on gender or against sexual violence. And most of the time, those are oriented towards protecting girls. Whereas sexual violence based on gender also affects boys. Boys are also victims of that. And very often we tend to think of males as those who commit violence and not as of those who actually suffer from sexual violence. So it would be a strong recommendation, I would say, and we are all making this advocacy work through different organizations and through the dynamics initiated by the Global Voice Initiative. It will be to attract the attention towards different duty bearers and financial and technical actors. We need to have more programs that would take into account that boys also need to be supported. They have special needs in terms of sexual abuse. And we need to have agents that will lead to have changes in the society. The second recommendation would be about the necessity to have programs, awareness raising programs, starting from the very early age. Those would need to be destined to parents and to children. In our association, we have those programs that raise awareness among children on sexual violence, and systematically all of our actions are intended towards children and towards parents, so as to create common knowledge and a constructive dialogue that can then be open about this topic. We consider that it is starting from the very early age, from the age where a child goes to kindergartens or schools, that this work needs to be done with children and with parents. Obviously, we need to adapt our wording, our how we phrase it, and about the relation of trust that they can have towards adults, and to show limits and to explain to children that not all adults are kind, so they need to not trust all adults. So we work a lot of that on in our awareness raising programs. We try to make children understand that when they don't feel at ease, they need to go and speak to adults whom they do trust. So opening discussions on different educational choices, being a parent isn't easy. There is no instruction for that. So it's important to recognize that it's a complex role. So we need to focus on the findings of different studies and researches that show that there are positive effects on the in psychological terms, that in the approaches according to which it's important to let children grow up as they feel like. If they don't feel like a boy or a girl, it's important not to format them into those genders. We think that it's important to be able to intervene and to make intervene experienced people who have succeeded in promoting and adopting more positive masculinities or more healthy masculinities, so as to foster adhesion through those experiences and witnesses.
Thank you very much, Odd. Yeah, I'm going to ask Rita now to give us her final recommendations. Please go ahead, Rita.
Thank you so much. I think we have to begin with family.
Rita, your mic again.
I think we need to begin with families, and we have to democratize families would be our first step, and to see that the parents socialize both girls and boys equally, that both boys and girls are cared and protected. We need to have regular sessions with parents, both fathers and mothers, initially separately, to discuss the importance of caring and protecting boys, to have an understanding of adolescence, and to realize that both girls and boys can experience sexual violence. That, I would say, would be the first thing that we need to do, be working with families. The other is a community. The community has a great say, and sometimes they are the ones who again perpetuate these notions. So we should have community safeguarding mechanisms. And in these community safeguarding mechanisms, the ones that Butterflies has, we have children and adolescents as members too, so that they can bring in their issues. So I think that it becomes very important. The schools, I think it is a continuum of care for the family, the community, and the school that we have to think of. The schools the teachers really need to be trained on the subject. They need to understand this and not brush it under the carpet and try to pretend that is not happening. The schools must not feel ashamed that if there is a case, then their school is at fault. No, they need to rise to the occasion. So I think schools, the teachers to be trained on the subject, and of course to be trained on internet safety. Most of these teachers are clueless on many of the things, so they can't even train the children on that. So we need to be having sessions on that. The schools must have trained counselors to support boys who are in crisis and experience sexual abuse. You need to have really trained counselors. All counselors do not find it easy to work with boys who are sexually abused, and boys find it very difficult also to engage with them. So we need these specialized counselors, and children must know whom they can reach out to and approach them when required. I would also say that the schools must have safe spaces. Safe spaces must be created in schools for boys and girls to speak and share their crisis that they're going through. Or for that matter, like previous speaker had said, you have sexual binaries which may be different. A boy might look very feminine, and that, or he may not be gay, but the fact that he likes to have long nails painted, color his hair, wear different kinds, you would find that these boys can be sexually abused too. So you need safe spaces in schools too, and that is the other recommendation. Public health centers, including hospitals, to have services for boys. Right now in India, we have for girls, but not necessarily for boys. So can we extend the services for boys? And lastly, media. They need to be sensitized because they are the ones who reach out to the general public. And if they are not sensitive and they can only look at sexual violence through the lens that only girls get sexually abused and that boys are perpetrators, and they demonize the boys in most of their reportings that they do. So we need to have dialogues with them, consultations with them to change the narratives in this sector. And also to say to even share with them our stories, to share with them our case studies so that they can write about it. I must say, to end it, I have to say 2 weeks ago, Butterflies organized a conference on mental health. And one of the panels was discussing about boys and their sexual abuse and what their mental health issues. And I'm so glad to hear that one of the mainstream newspaper has picked up that, and they're going to do a whole piece on boys and sexual violence. So I think that is an opportunity for us, and we need to engage with them because they are the ones who actually influence the general public. So we need to work with the media too. Thank you. I kept my time.
Thank you very much, Rita. I think your analysis about the different actors and levels that we can connect to, and thank you very much for sharing your experience in your last mental health event. I would like to thank everybody, Omati, Hassani, Ord, Rita, Nelson, every one of you for your participation. I think it was very interesting. There are a few questions in the chat that we're going to share in the platform, Changemakers platform, because there were so many good ideas here, and there were things that were very clear as well coming from this speech. And thank you very much for everybody. Family for Every Child team, the interpreters as well. It was a pleasure to have you here. It was a great audience this time. So let's continue this conversation in the Changemakers for Children platform, and let's give this the turn. Let's give the floor for the expert to talk about the next steps. Rajiv, the floor is yours.
Thank you, dear Hema. I think we are really short of time, so therefore, I would just shorten my screen. I'm really sorry that we couldn't take your question live. But as Diohema said that your questions will be posted in the Changemakers platform, and I would request all the panelists to provide answers to those. Having said that, Felipe, our team member, has also posted a link of our Caring for Boys research. In that research, if you go through, you will find all the answers of your questions too. So I would request all of you to go through those research reports. And as we are approaching to the end of today's online event, I would urge you to also join the Changemakers platform through which you have registered yourself in this webinar. And our team member will post the link in the chat box now. And also, I would request our team member to display a poll question, display our poll questions here. And can you please answer this brief poll that has appeared in your screen? It is important for us to know your opinion. And I would again thank all the panelists for their time and sharing their practices. Thank you, Diohema, for your wonderful moderation. Thank you, ICPAT, especially Francisco, for all the support and collaborations. We have a long way to go. And we hope that we will see you sometime soon in another online event. Thank you so much for the participants. Thank you so much for the panelists for sharing your insights, views, practices, and all the preparations that have been done behind that. Thank you, team. Thank you so much. We'll see you.